Thanks everybody for coming today. I am Adam Hill. I'm with Forsyth Futures, and we're excited to kick off this presentation series. This is the first one we'll be doing out of 4 on different topics where we'll be sharing local community data across a number of different issues, and also have conversations with different community stakeholders who are actively engaged in doing work around the different topics that we are sharing data on. So excited to kick this off with you all. And I'm going to introduce Vivian, who will be the first person talking today. Vivian Perez-Chandler. Oh, is this going? Oh, no. Just a second. Yeah, could you get it on there? Okay. Vivian Perez-Chandler is the Executive Director of the Asset Building Coalition. Thanks, Vivian.
Thank you, Adam. Good afternoon, everyone. It's a pleasure to be here with you today and to kick off the first of the series that Adam mentioned. The topic for today, as we know, will be a conversation on the local economy, income, and jobs. And with this, there we go. Okay, it works. With this presentation, we want to also just acknowledge this is a Forsyth Futures hosted event that is supported by Action for Equity, Reynolds Charitable Trust, the Winston-Salem Foundation, and the Asset Building Coalition. So economy, income, and jobs. As we know, jobs are a crucial part and component of the economy. Specifically with economic mobility, as they contribute to the overall income of individuals and households. A robust economy typically supports a diverse range of jobs, providing various income levels and opportunities to residents. How we as a community have become catalysts, and specifically with the Asset Building Coalition. So in 2012, a study was conducted in Forsyth County that really talked about some of the different profiles and data about asset poverty, the rates of poverty, poor credit, a lack of savings, and really noticing that those were worse in the area in many other places in the state and our nation. Out of that is where we recognize, so asset poverty is when a family or an individual don't have 3 months worth of savings to cover for their basic needs. And with this study, it really looked at how many people were in extreme asset poverty. And at that time, that rate was 22% of residents in Forsyth County. And so really looking at those studies that came out and seeing, well, what can we as a community go into and actually do and to change those different rates. Also, a 2018 Harvard study showed that Forsyth County was ranked 3rd from the bottom in the entire United States in terms of economic mobility, which I am hopeful that all of you have heard that statement before, because it is not new. Unfortunately, we have been categorized pretty high or pretty low ranked on advancing economic mobility in Forsyth County. So a little bit of background on the Asset Building Coalition. The Asset Building Coalition was founded in 2015 when we came out of that report, the Municipal Economic Report done in 2012. To really coordinate and align a collective response and to, again, raise awareness about asset poverty before people get to poverty. And we incorporated in 2019. Our focus was on improving the community financial stability through our mission, which is to build, rebuild, and protect the assets of residents in Forsyth County. Through that, as a coalition, we coordinate and align local data and research and action efforts as a coalition of 41 organizations composed of for-profits, nonprofits, as well as individual community members in the community. Our funding is primarily from the Winston-Salem Foundation, KP Reynolds Charitable Trust, and C. Smith Reynolds. And we are partnered with Forsyth Futures to help us really look at the data, in which we will also hear a lot of our work in today's conversation about jobs. So a high level perspective. We are here to work on the to improve the financial stability for everyone in our community. And a big part of that is the livable wage and benefits cliff work. Living wages, that is something that we have heard being tossed around in various ways. And what is a livable wage? We have done quite a bit of work around that through data with Forsyth Futures, and you will hear more in depth about that. But really also talking about the benefits cliff. And just a brief mention about that, that's when someone is receiving a public benefit and a 50-cent increase will actually kick them off of receiving a public benefit, ending in a deficit. So if they were receiving a $1,200 childcare subsidy, because of a 50-cent pay increase, as they are looking to improve their financial stability, will actually end up being unfavorable to them. And so recognizing that the benefits cliff is an economic mobility challenge as well. Jobs and income are critically important because we want to ensure that everyone in the community has financial stability and is able to earn enough, not just to survive, but everyone is able to earn enough to save and get them out of asset poverty. And so I've mentioned people don't have the money they need to meet a rising cost of living. I mean, we have seen it a lot more now than at any other point before the pandemic or during the pandemic. And really, one of the biggest things for ABC is achieving financial stability is way more complex than just rising our wages. And now I am going to turn it over to Adam, who's going to tell us a little bit more about that data.
Thanks, Vivian. So I should have mentioned this before. The structure of today, we're going to have a kind of a brief presentation, giving an overview of the topics first. Then we have some posters where we have more details on these specific topics we're talking about, livable wages and benefits cliff. And then we have a lovely panel here who is gonna continue to talk about these issues and kind of how we're approaching it as a community. So that's the kind of the general structure for today. I should have mentioned that on the front end. So just a bit more about Forsyth Futures is that we're a local nonprofit. We do local data and research that helps support community initiatives like the Asset Building Coalition. So we've been around for over 40 years and really played that role of providing data and research support for community action in the last 10 to 15 years or so. So is it shifting with this? Oh, thank you, Kat. You're on it. I was like, wow. So as I mentioned, Forsyth Futures, we study the community to inform action. And there's a number of things I think we're really trying to shift as an organization over the last couple years. Traditionally, as an organization, we really mostly worked with institutional stakeholders. So groups like school system, local government, philanthropic organizations. And I think, we really were there to help serve their data and research needs. And we recognize there's lots of shortcomings in that approach by not making sure that we are also bringing in perspectives from residents who are actually experiencing the issues we're studying. So that's a major shift we're trying to make as an organization, is making sure that the residents who are experiencing these issues are actually helping drive, what research topics we tackle and how we're thinking about, taking action as a community to help improve these issues. So that's one major, shift that we've been making, and we've been partnering with an organization called Action for Equity. They're a grassroots advocacy organization, and they're here with us today on the panel. certainly really grateful to Action for Equity and kind of embarking on this work of really making sure that the actions we're taking as a community to address these issues are really led and driven by residents. So other things that we are shifting as an organization is we're really trying to make sure that the research we put out is action oriented and can directly contribute to change in community and really changing material conditions. I think a lot of research often, the research is conducted and then it gets put on a shelf and doesn't necessarily always get utilized to promote change and action. So by partnering with groups like Asset Building Coalition, we're really trying to partner with the groups who can promote and advocate for changes that will improve conditions we're seeing in the community. Another major change we've been making is really shifting away from, shining, the microscope or the research we do on individuals and households, and really starting to look at how systems and structures are contributing to the negative outcomes we're seeing. And we'll talk a bit more about kind of how you make that shift of moving from looking at individuals and households to really looking critically at systems. And as we've been talking about, we've been partnering with the ABC, really focused on this livable wage issue as well as benefits cliff. So what is a livable wage? So this is a good example of really thinking about a systems measure. If you're looking at something like income, that's really focused on the individual or the household, versus livable wages is really looking at how are employers contributing to the wages they're providing, contributing to the outcomes we're seeing. So this is a good example of kind of changing the research and what we're focused on and really looking at systems versus individuals. And we've been doing this work with the ABC since 2019, so it's been for a few years. And kind of where we're at this stage is, we've identified the wage, which we'll talk about in a moment. And we're actively talking with employers and employees to really start to build out, how are we going to launch a certification program and a campaign around the wage that we've identified. And this will be a voluntary program, and ABC is really spearheading these efforts. The goal is to be launching the campaign in next year, 2024. So how did we get to the living wage? So, around 2017, we as an organization, we're still looking at things like the poverty measure. We identified, what the shortcomings are related to the poverty measure and shifted to income insufficiency. And that has been kind of the building blocks for how we identify what wages are going to be required to really make sure that, households' living expenses, that the income that they receive, they can meet those living expenses. And this is the kind of the vision of ABC, is that, that they'll champion the livable wage as a tool for greater financial stability for more people in our community. And that, the solutions that we identify, we need to take into account the entire financial situation and family composition, including, the public benefits that they may be receiving. So what are these different measures? So first, looking at poverty, this is an example of an individual measure because we're really looking at an individual or household. Another issue with this measure is it's a really low income threshold. So what we found is that the income that's associated with the poverty threshold really doesn't even make it so that households can cover basic living expenses in Forsyth County. Another challenge with the measure is that it's one size fits all. So the threshold is the same across the entire country. So it doesn't account for, differences in living expenses by geography. And one other note about the poverty measure, it is widely used to help drive kind of who's eligible for, different public benefits programs. So that's kind of the poverty measure and some of the issues and challenges with that. So Around 2017, we started trying to think differently about how we look at, who's making ends meet versus not in our community, and started shifting to income insufficiency. So here, again, this is an individual measure, so not yet shifting to systems. But the advantage here is that we really looked at what are expenses in Forsyth County and what types of income would cover, localized expenses. And that the income insufficiency measure has been kind of the groundwork of the livable wage. So what's built into the income insufficiency? So here's a list of all of the different expenses that we identified and have incorporated in how we're estimating what living expenses are in Forsyth County. So we've included, if there are children in the family, childcare expenses, food, healthcare costs, housing. We have built in savings because the mission of the Asset Building Coalition is that people can get out of asset poverty. So we need to make sure we're building in savings so that they have that cushion available. We've incorporated tax expenses, transportation, and then just general household expenses such as clothing, phone service, and the internet. So those are all the types of expenses that have gone into, our estimation of what it takes to cover living expenses in Forsyth County. So this is a little bit of data that shows, the percentage of residents in Forsyth County who are below these different thresholds that we've identified. So you can see here that there's quite a large quantitative disparity between those who are living below the income insufficiency threshold that we've identified compared to the poverty threshold. So the income insufficiency threshold is considerably higher than the income level that the federal government assigns for poverty. So if you just looked at poverty, you might think we're doing okay as a community, but you can see on income insufficiency, there's about twice as many people who are not meeting that income threshold. So what does this look like from a household perspective or standpoint? So just wanted to provide some numbers. So here you can see we have a number of different household compositions, and these thresholds, are pretty largely impacted by kind of who's in the household. So here we have one working adult household, 2 adults and 2 children, and then 1 adult and 2 young children. So the top row is kind of the income that's associated with the poverty threshold. The second row is estimated household expenses, or that income insufficiency threshold. And then the bottom is the difference between those two. So you can see there's pretty huge differences between what we've identified can cover basic living expenses compared against the poverty threshold. So there's a really huge gap if you're just looking at poverty. And then wanted to show kind of how do those total annual living expenses translate into wages for working adults who would be working full-time. So you can see here we have the orange is the total living expenses that we've identified to cover basic expenses. And then blue is the wages that would be needed for all of the working adults in those households. So you can see the wages that are required, greatly vary based on the household composition. So just one working adult would need to be making $13.77 an hour to cover basic living expenses. And then on the other extreme, we have one working adult with 2 young children family. That person would need to be making $32.87 an hour. So you can see the wages required vary quite dramatically depending on the household composition. So that that presents a bit of a challenge because if we have a lot of variability about the wages that would be needed to cover living expenses, how do we determine what's the right wage to be advocating for and campaigning for as a community that would cover, you know, our community's residents' living expenses. So the Asset Building Coalition had a committee who actually, you know, deliberated on this and really was thinking about, you know, what wage should we pick as an organization to advocate for employers to be adopting, so that we're moving the needle on, you know, people's incomes increasing and being able to cover their living expenses. And so that what this shows is the wages that would be required to cover, you know, different amounts of households in our community. So the, you know, the bars furthest to the left, that is the average wages that would, the wages that would be required to cover the average across all the households' living expenses. So you can see, and then the blue versus orange is if you include childcare expenses. That's the blue bar, and the orange bar is not including childcare expenses. So depending on which measure you pick, you can see the wages vary quite a bit. The average is the first one, the median is the second one. So that means that's the wage that would make it so 50% of the households in our community are meeting the income they needed to cover living expenses. Then the 75th percentile, that wage would cover 75% of households. And then the furthest is the 90th percentile. So that wage would cover 90% of households in Forsyth County. So you can see, depending on, you know, what percentage of households you want to make sure are able to cover living expenses, it varies quite a bit in terms of the wage. So the group picked the 75th percentile because they felt like that was considerable progress. But the issue with that, which they, you know, readily recognize, is that, you know, that wage of $23.94 an hour isn't sufficient for 25% of the households in Forsyth County. But you can even see that, you know, that's way higher than the wages, you know, that are part of the dialogue, like the $15 an hour. So you can see that even a wage of almost $24 an hour is only enough for 75% of households in Forsyth County. So just to reiterate kind of where we're at, you know, the ABC has identified the wage that they're going to be advocating for, and they're currently running learning sessions with employers and employees to help inform the design of the campaign, and then they'll be moving to launching the campaign, and the goal is to launch in 2024. Any questions on the livable wage? I'm going to jump to benefits cliff next, but I wanted to just give just a moment, and you'll be able to kind of jump deeper into this with the data walk as well. But just wanted to give a moment about, see if there's any questions on this topic. Yeah.
Because I think that, like, oftentimes we just make an assumption that people should only, like, do the things that are necessary and not the things that, like, are joyful to them.
Yeah.
That they're allowed, like,
Yeah.
And so I'm just curious to wonder, like what else?
Yeah. Elizabeth, do you know the answer to that? She's the one who helps crunch all the numbers, so I think she would have a better answer than me.
Can you hear me now? Excellent. Sorry. I'm also like probably one of the most soft-spoken people on the panel. So yes, I have helped crunch the numbers. Unfortunately, the analyst who took the lead on this is out for a family emergency this week. where this data came from, if I remember correctly, I think it came from the Consumer Expenditure Survey. There might be more information on the posters over there, and there's definitely more information on our website, or if you want to grab my email, I can look it up. The other expenses, I believe, does include things like reading materials and like cleaning things. There's really a lot of things that fell down in that category, but your point is well taken. I would have to just, it's unfortunate that Courtney's not here because I'm sure Courtney would know just off the top of her head. I do not remember all of the things that fall in the other expenses category, but I do remember that reading materials were there.
And I do remember.
I have it.
Oh,
I pulled it up. I was looking for it. Because yeah, there were so many things considered into it. And so in other expenses, it does include apparel, services, housekeeping supplies, personal care products and services, reading materials, including subscriptions to newspapers and magazines, and miscellaneous expenses. So those might also be expenses like bank fees, legal fees, and things like that. It doesn't, however, say, the fun things. There's not a category for fun. And I want to say probably because that's not a measure in like data that's usually included as, entertainment. However, thank you for bringing that up because it's now, this is exactly why we have these conversations as well and include community members so that there may be something that we didn't include as well. Thank you.
I don't think so. Yeah. But we will check on it.
I don't think it was yet. I do remember that being part of the conversation about the savings, that the idea is that your wage is high enough to be able to start putting money either towards paying down debts or building up assets. This is, I think, maybe jumping ahead in what we're going to talk about, but like, I do think that there's still a lot of space for us to be getting more input from the community about, are these the right costs? Have we included the right items? I definitely would not say like, this is the perfect measure yet.
Yep. Yes. Yeah, so we did include before and after care for elementary school students as well, because if it's a full-time working adult, the school hours don't cover the full working hours. So we included before and after care expenses for younger children. I'm not sure about other expenses. Pre-K is included too. Yeah. Yep. Like childcare and pre-K are included there too. Yep.
We assumed that anybody under the age of, it was either 12 or 13, whatever is kind of like the legal, you are allowed to be left at home alone, that you needed some kind of summer care or after school care if you were enrolled in school. And then we used the cost for each age group for full-time childcare and a 4 or 5-star childcare center.
Right. Great question. So we also wanted to share a bit about the other program that we're working on with the Asset Building Coalition, the Benefits Cliff. Vivian talked about this a bit, but this is really the phenomenon where the public benefits programs that are available for people have eligibility limits, and in some of the programs, what happens is once a family crosses the income eligibility limits, they would lose that benefit, and it would create in some instances a big decrease in the amount of benefits they're receiving that would not make up for the increase in the income that they may be making. The three biggest public benefits programs are food and nutrition services or food stamps, childcare subsidy, and then the housing choice voucher. Like I said, with these different benefits programs, some of them have bigger cliffs meaning, with small income increases, you could lose a large amount of benefits. And others are designed as slopes where, you know, as your income goes up, the benefits you receive gradually decreases. So the child care subsidy program is an example of the benefit program that has the biggest cliff, because those costs are really large, and the income eligibility limits are not that high. So that one has a large cliff. Food and nutrition services has, in some instances, has a cliff. And then the housing choice voucher is an example that's a slope where it just decreases until a family, eventually, if their income's high enough, wouldn't receive any benefits. So I just wanted to name that the design of the program varies a bit on kind of how negative an impact there could be with income increases. Also wanted to mention that, you know, the cliff isn't the only issue with these benefits programs. Other issues are that there's limited supply, and that's the case with child care subsidy and housing choice voucher. So there's only a certain number available, and I think the housing choice voucher has often had an extremely long waiting list. That's often been the case with the child care subsidy program too. So there's definitely other issues related to these different benefits programs and how they're structured. So what does this look like? So here is a graph of a family's income, and this is for a family of 1 adult and 2 young children. So I think both of these children are under the age of 5, and this family has those children enrolled in child care facilities. So what you see here on the x-axis is the monthly pre-tax income for the family, and you can see, like, you know, that's increasing from left to right. And then the y-axis is the after-tax plus total benefits that family is receiving. So the blue line is the line that represents the family's income plus the benefits. And then the green line is if that family was not receiving any public benefits. And I believe this family is enrolled in the graph. The blue graph is showing that family enrolled in child care subsidy, housing choice voucher, and food and nutrition services. So what you see is that the family's income is increasing from left to right. It kind of plateaus, and then all of a sudden, when they get to $24.60 an hour for that working adult, they lose the child care subsidy, and that's what's represented by that big drop. And that's about $1,000 a month of benefits that they are losing once their wages go above that $24.60 an hour level. So this is just a visualization of what that cliff can look like. But I also wanted to point out the plateau effect, where basically all these programs, as well as your income increases, the benefits you receive decrease. So when you stack all the benefits on top of each other, and, you know, each additional dollar the family makes, you lose like 10 cents or 20 cents of benefits. What that does is it makes it so that, you know, over that huge income range, the family really isn't feeling an increase in income. So that's another issue with the way these are designed, is that it doesn't really promote upward economic mobility, because as people's income increases, the benefits are taken away from them. So that is the introduction to the benefits cliff. And I think we took longer than we thought for the presentation. So any additional questions about benefits cliff? And then I think we're going to adjust our schedule to make sure we maximize time for the panel and do that first. And then if we have time left over, we'll do the data walk. But I do want to mention there's a QR code in your agenda, which would bring you to the posters. So if we don't have enough time to get to those, that's how you could get access to that information. Any quick questions on the benefits cliff before we switch over to the panel? I will say the ABC is actively identifying kind of advocacy positions that they want to be taking to advocate for changing the program so that they don't have as negative of impacts on household outcomes. So that's another major thing that the Asset Building Coalition is working on is advocacy around changing these programs to not have as negative of an impact. All right. If there's no questions, I will hand it over to the panel. Yep.
We're recording it, so they're making us use mics, which I will be really bad at. So feel free to yell at me if I forget. My name is Katie Sonnen Lee. I'm one of the co-founders and board vice chair for Action for Equity. I'm not sure your agenda might say Kelly Easton, which I am not Kelly Easton. I could never be Kelly Easton if you know her. She's incredible. But I'm covering for her today. So I'm going to do my very best to at least do a little bit of justice to how wonderful Kelly is. And so my name is Katie. My pronouns are she, her. Again, I'm with Action for Equity. And this topic is so relevant to me, both as a parent of 2 young children. I grew up in a single parent household. When you were talking about the benefits, Cliff, and people not quite qualifying for benefits, but still like we were counting pennies to get food. You know, we were relying on our church to give us food. We never qualified for benefits, but it's hard. And then professionally, this is what I love to work on, is making sure that families and people can thrive wherever they are and whatever their circumstances are. So I could go on forever, but I won't. I want the panelists to be able to introduce themselves. So if y'all can introduce yourself, your pronouns, your organization, if you're here representing an organization, and just share how this topic is relevant to you personally or professionally.
Hello, everyone. My name is Dr. Crystal Ellis, and I'm the Vice President of Research and Advocacy for Action for Equity. So this resonates with me because I come from the perspective of an organizer, a researcher, and a strategist. So I'm always encouraged to think through ways to make sure that research is leading to strategic change, to material change, and making sure that the realities of people that are closest to the place of urgency are being prioritized, and just making sure to prioritize advocacy. So I'm always approaching it from the perspective of how do we increase our understanding of how research can be used as an organizing mechanism and do more informed organizing for sustainable change.
Vivian Perez-Chandler, again, with the Asset Building Coalition. She, her, hers, my pronouns. And I would say, so personally, I've, as a Latina, originally from Guatemala, you know, one of the main important things has been to always advocate for wages within the immigrant community, because it's so often, depending on immigration status, affects us differently. And so I would say from that perspective, being a former undocumented individual, is thinking on how to actually not only advocate for living wages for our immigrant community, but really for all of our communities, specifically those that have been primarily been oppressed by not earning living wages. And so specifically to that, changing those policies. And if we can't change the policies, kind of figure out other ways in which, through the voluntary program that we are creating, trying to shift those ways in which our community can earn living wages and reach economic mobility and stability.
Hi, I'm Sandra Fischel Booth. I'm with the Winston-Salem Foundation. I'm a program director of their focus area investments. The Winston-Salem Foundation is a community foundation. We have a very long history. We have like 100+ years of supporting in Forsyth County, but really only in the last 5 or 6 years did we begin to really think about economic mobility and how we could support that and be more strategic with the funds that we have available at the foundation's discretion. And so we began to work towards 2 focus areas: advancing equity in education and also building an inclusive economy. And so now the majority of our, I would say our grant making goes towards supporting those 2 goals. So I've been in philanthropy for about 17 years, and I don't know that I would have continued on in philanthropy if the sector as a whole had not begun to really interrogate our practices and thinking about how we have perpetuated harm. And when I say that, I mean funding nonprofits to do what they have always done, and for institutions to make all of the decisions as if they have all of the knowledge. And so I gain a lot of energy just from being in the room among other like-minded people and having conversations like this.
Good afternoon, everyone. My name is Dr. Kristen Naney. I'm the Director of Learning and Impact at the Cape Reynolds Charitable Trust. And I think this topic is relevant to me personally, just from an equity perspective, but also being from a small town and you know, there were a lot of people that depended on this one industry in our town. And when that went away, it had such a significant impact on the quality of life of people from where I'm from in Virginia. And I think professionally, that's our primary mission of the trust, is to improve the quality of life of people with low incomes in Forsyth County, as well as across the state.
Oh, there we go. I'm Elizabeth Lees. I'm the Director of Data and Research at Forsyth Futures. And I think Adam's already introduced kind of what we do professionally and what our work is. I think for me personally, I am the mom of 3 children under 6. So when we talk, like, it just, and I realize that, like, I come from a really privileged position and, like, we're able to make ends meet, but it's really hard, even with a lot of resources, to make having a young family work. And that is just something I really want for our community, is that we live someplace where everybody has enough and where all of, like, especially the children in our communities, everybody's knows that their needs are met. And yeah, I'll pass it on.
Hey y'all, how y'all doing? I'm Marquita Wisely. I am a community organizer and engagement specialist and a certified community researcher, and also a member of the Benefits Cliff Learning Team. And I think this topic is very important to me because I have lived experiences with this issue, and I'm also living in the issues that we're discussing today. I'm a single parent of 5 children, 3 of them in college. And 2 of them elementary, middle school, but I find it hard to just get by sometimes. And I'm tired of struggling. I'm tired of watching my neighbors and my family, my community members struggle with issues that are perpetrated to be our fault, but they are systematic and institutional issues. And that's the way that it was designed. And so I try to make a very conscious effort to get out every day and advocate for living wages for people in my position, but also try to do the work with people on the panel that are like-minded, that want to find a solution to these issues. Because, like I said, I'm tired, and I know that people in my community are tired of working all the time and never being able to rise above their position. And also, I don't think that's fair. And so I want to do whatever I can to make things not just fair, but equitable for everybody in Winston-Salem, so that we don't have to continue to have this same fight all the time.
Thank you all. I feel like we could just continue the conversation from there, sort of, because I think we all have a lot to say, and we all, I think, mostly know each other. So hopefully we can have just more of a, I mean, it's a panel, but really a conversation today about these topics. The first question I have, the data presented by folks today highlights really a case study in the challenges of bridging research and action. Like, the research shows what we need, but how do we get there, right? By selecting a living wage amount at the 75th percentile, the most vulnerable workers in our community are sometimes left behind, families with young children, the folks on that benefit cliff that we talked about. On the other hand, many employers, especially small businesses, may find it really hard to reach that living wage that it's not the 24, whatever it was. Thank you. May find that really hard. And I think we've seen, the fight for 15, which has been around for 10-ish years. And a lot has changed in that 10 years as far as prices. And just in the last year, talk about inflation for food, housing, all these other things. So we know 15 really isn't sufficient, but that's the number that we hear a lot, right? But so when we're balancing the needs of community and small business and just the community in general, what insights do we have on how we can move forward as a community? And I'll throw this one to Vivian first. That's okay.
Yeah, this is one thing that when we as a committee chose the 75th percentile, it was one of the hardest things to choose. One, because we wanted to be at the 90th percentile, the 100th, to really ensure that everyone was covered. And recognizing that our minimum wage in North Carolina hasn't changed since 2009, and that's $7.25. And so recognizing that and also thinking, well, what can we do? And so the insights that we have are really more of how can we as a community, which is why we're conducting the learning sessions with employers as well as workers who are not making that $23.94, to really hear specifically from those smaller, like homegrown businesses, to see how do they think this could work? Because we don't want to create a voluntary program that essentially no one is going to want to be a part of, because the reality is to be able to pay at $23.94 is a lot to ask for some of those smaller employers. And so that's one of the first steps we're taking, is hearing from them directly to see what could be a way. And also we're a part of the livable wage network in the country. And so using some of the ways that they have figured out how to help them. So they actually have like one-on-one sessions to figure out how far they are from reaching that. And it may not be as far as they think. So I think from our perspective, it's also recognizing that by creating this program, it's going to be a tiered program with the goal of getting to that wage. So it may be that we have 2 tiers or 3, because that's still being developed once we hear back from what works, what would work best. So really working along with community members to help us design that, instead of continuing that approach that we had been doing for years of just, hey, we're here to create this and it doesn't work. I wonder why.
I was about to say my microphone ain't working, but I think one of the things that we could do is as a city, as Winston-Salem Forsyth County, to meet the needs and to offset some of the costs if small business owners were to go up to that larger wage, is to offer them certain tax breaks and incentives. And if you look at city and county budgets, they do not put a lot into the benefits that we receive, that people receive from social service networks. And because of that, I think it makes it a little hard. Like the budgets for those are very low. So if we look at city and counties and partner with them, and they put some of their city county budgets into, I won't call it a stimulus, but like a wage break for small business owners who want to raise their wages but can't afford to, or give them certain tax breaks so they can raise their wages, or offer certain childcare things. I think that would kind of help us move forward a little bit. So that everybody could be able to do it, because I think that might be the only way we can with small business owners, because I don't think they can afford to. But like if cities and counties bought into this and offset some of those wages with certain tax breaks or certain payments, I think that could work, and it's working in other places around the country. So I think it's something I would like to see us try here in Winston-Salem.
I just want to add on to what Marquita shared. And I think that also speaks to the larger issue of how are we understanding it systemically? How are we understanding that why are these inequities persisting? Why are these gaps persisting? And how are we using what we understand, what's emerging from the research, what's emerging from the community engagement work, to inform organizing, to begin to shift the larger infrastructure, to begin to shift policies that would better align with what the needs are, and better align with what small businesses need, what Black-owned businesses need, to be able to address those persisting inequities.
Yeah. And while I'm listening to you all talking about small business, particularly, I think, if you look at the research, a lot of small businesses are owned by people of color or women or immigrants or communities who are already being harmed by some of these extractive and oppressive systems. And so how can we make sure we're not hurting people twice or 3 times or 4 times, depending on their identity? And the other thing that I'm thinking about is what you were saying about joy, and like that shouldn't be superfluous, right? That shouldn't be like, oh, that's just icing on the cake if you can. Like we all need to live and thrive and be whole people. And if all we're doing is working 2 or 3 jobs sometimes and trying to get enough sleep, that's not it, right? That's not how we're going to have a whole community that can really bring us all together. Because I really think if we want to reach that liberation where we're all getting what we need, doing what we need for our communities, it's not going to happen if we're all sleep deprived and working too much. That's not where most of us are the happiest and willing to put forward what we need for our communities. And then the other thing, talking about all this research, everyone on this panel is connected to it in some way, right? There's different research that we hear and some of the other work that's going on in the community at Forsyth Futures or Action for Equity or maybe Asset Building Coalition. Sorry, I always use the acronym. Everybody's connected to it, either by funding it, doing it, supporting it, whatever. So giving all of our emerging and evolving understanding of what it takes to do community-based research well and do it more effectively, do it more equitably. How are you or your organization evolving? Like, what have you learned? Because we really have to transform this whole system. It takes funders funding the work. And I work in philanthropy for my day job, so I can call out philanthropy a little bit. It takes funders understanding it and funding the work. It takes nonprofits and community groups understanding what their communities need, really listening and doing the work. But it's like an ecosystem, right? It's not one or the other. We need it all. So when you think about this, how is your organization evolving and working towards this to transform this ecosystem that we're all in? Can I throw it to you, Kristen?
Thanks for that question. So at the Trust, where we've evolved and we're continuing to evolve, I think to really do community-based research well, you first have to look introspectively at your organization's practices and beliefs. That's one thing that we did recently with our 75th anniversary, and we were able to examine the Trust history and the harm that we've caused in community. I think another is to see where your organization stands on the issue of equity. And we've developed an equity framework for our organization that supports our beliefs in equity and the thread of equity throughout all of our practices. Another thing that we've changed is really who we fund. Early on in the foundation's history, we were funding a lot of institutions, and we've shifted those practices to fund more grassroots organizations and people of color, and to really build power amongst those organizations. And those are really the groups who are on the ground, who have the expertise, who just have the knowledge, who have the skills to really do the work in community, and as well as the relationships. Another thing we focused on is how we support organizations. So while we work with so many brilliant organizations, but we've really invested in people. So we've come along beside them and helped build capacity of these groups. So it may be investing in their data literacy and capacity. It could be investing in their operational support, mental wellness. It could be any number of factors, but we truly believe in providing those additional support so they can, they're already doing the work well, but just to do it even better with this these extra supports. Another thing that we've done, one example, I guess, also of just building capacity is our community data and learning cohort. And since I work in data, that's the example that I'm going to give. But We've partnered with organizations and had this cohort where we're building their data literacy and capacity, helping them network with other organizations locally. We're also just providing TA assistance and really co-designing tools with the community to see, what would be most useful to their work. So it's really a partnership with community. And then lastly, I'll say we've included more opportunities for community voice in our work. And that's something that we've been doing for quite some time. I mean, we always start by listening, but we've had other opportunities for community to inform our work through different convenings, the co-development of tools, like I mentioned, also just with different surveys. So we've had our grantee perception survey where we're getting feedback on from community and how we do the work, and with different evaluations that we're doing with our Healthy Places evaluation recently, getting community feedback there. So those are just kind of a few examples of how we've evolved, and we haven't arrived, so we're still evolving. And yeah, I'll pass it to Sandra. Okay.
Yeah, I just want to say how much I really appreciate having KBR in this space. I think that you've been doing really great work and leading by example, and it's been really wonderful to just have you as a partner. Like she said, this is a journey for us. And I think that when I think back to how the foundation used to support grant making, it was very much sort of one-offs, and we were kind of generalists. But then when we began to really think about these larger issues and how we can rally like community around systems, we began thinking about who needs to be at the table. And so in I believe it was 2018 or like somewhere around 2019, Adam, when the public benefits cliff work was started, and the foundation was really intentional in making sure that as we were thinking about the public benefits cliff and learning around this work as a community, that we would actually have individuals who were impacted by the work. They're thinking about solutions and doing the work. Marquita, you were there from the very beginning. And I would say that while I thought that that was a very good first step for us, I also think that we were too prescriptive. Like, we set everything up like foundations like to do and control it. And we decided exactly like we were going to work on the public benefits cliff. We were going to have solutions around these 3 or 4 areas. Now I feel like, looking back on it, I realize that as we move forward, community really needs to drive the issues that they are going to work on. And so I think that we're just going to continue to move in that direction and do more work there. I also think that the way in which we give out funding, program support is wonderful, but operational support is key. I think that we have got to move even closer to giving operational support to organizations that are doing work in community. I'm happy to say that we provide operational support to ABC, but we need to be doing it for other organizations. That is not to say that we will not support positions, but when we do, we also need to think about what positions are we really valuing and supporting to build capacity in organizations. We need to have far more Dr. Ellis's out in community. She can't do it all. And so those are just some examples of how we've sort of shifted the way we were working, and where I hope we'll be going towards in the future.
Sorry, I turned it off. But yeah, no, I'm just nodding a lot because I think a lot of what Sandra is saying, especially about the tendency of institutions to be like, well, we know what we need to do. I've worked at Forsyth Futures for 11 years now. So if you hear me talking about the ways that Forsyth Futures has unintentionally done harm to the community and the ways that we have not done a good job, I was often like specifically responsible for a lot of those decisions, and I really regret that. So that's just definitely a transition I'm seeing, is I think I'm learning that there was a point in my life where I was like, oh no, I'm a researcher and I know what we need to study. And it's just really critically important that we step back and that we listen to people who actually know what they're talking about because they have lived experience and know what's going on. So like when we're having these discussions and people are like, well, why is there no entertainment budget? And you're like, well, that would have been a really good thing to include. Yes, like just instead of that being something that comes up on the back end of research, it really needs to be something where community researchers are leading and calling the shots of what research gets done, what research needs to happen, and then like, how do we develop these measures? Do these measures actually measure what we think they're measuring? And that's the direction that we're really trying to move in as an organization, is where we're working more directly with community members, and we're also getting community members' input and oversight to make sure that we're not accidentally releasing research projects that could be harmful or could be used in ways that harm the community, because that definitely happens.
Yeah, I think I have all these Post-it notes around my monitor screen at home. All these reminders I need to think about while I'm in meetings or talking to people or just thinking through things. It's not like you have a meeting at 7:00, although sometimes I need those and I don't do those. But they're the things that I need to remember. And one of them says, now that you know you don't have to be perfect, you can focus on being good. And as a recovering perfectionist, I really need that in my face every single day, because I think a lot of institutions have done harm. White people have done a lot of harm in this community and all communities. And it's sometimes you can get stuck in like trying to be perfect when in reality we're always moving to be better, right? We're never, like, people talk about, oh, we're on an equity journey at their organization. I know some people in here have heard that. And that sometimes makes it sound like really it's like a train station you get to and like equity, and like that's not real, right? We're always moving forward on that equity journey to do better than we were 5 years ago, 10 years ago, last year, last month. But I don't think it's somewhere you ever arrive at, because we're always learning more about how we can do better in community. And so thinking about all of this and how there is this promising direction towards shifting our organizations, shifting the way we think, as institutions. And I think as institutions, we would all love if one day we didn't have a job at an institution that was trying to bring about equity, because we had people in the community had what they needed, and they didn't need an asset building coalition to advocate for them, or an action for equity to advocate for them, or any of these other organizations, right? It would be great if we just had what we needed. But since we're not there yet, we're heading in that direction though, right? And so in the spirit of constructive dialogue, which we're here for today, what could be done better or differently in future iterations of this work? And do you see, or how have you seen potentially harmful or extractive aspects about this body of work? And I'll just, before I pass it off, I'm going to pass it to you just so you can start thinking. I previously worked at the Black Philanthropy Initiative, and I'm on the board at Action for Equity and have been for a long time, and got to really see sort of this evolution that was going on in Forsyth Futures and in the foundation, as we were actually going through this process of research, and how we really had to think deeply about how we can be less extractive and less harmful to communities, less like, tell us all of your pain and trauma so we can write it down. That's not helpful, because what we want is to hear from community what the community needs so we can find out a way to make it happen as people sitting at a table of power, like a foundation or a large institution. Okay, that's my soapbox. Crystal.
Thank you, Katie. So I'm thinking about what Adam said earlier about how to shift towards more systems measures. And I think that's the clearest answer to this question, because it takes a paradigm shift. It takes thinking about, okay, how do we understand a systems measure? The first step is understanding that there are certain identities that are used to create a baseline of what economic mobility looks like, about what health looks like, and about what resource accessibility looks like. And historically, those identities have been white and heteronormative. So what that means is you take a look at a needs assessment that is based off of a baseline or compared to a line that is compared to historically privileged identities. And that creates an immediate like displacement of what's necessary to eliminate these barriers. And so how do we address that? We begin to look at it systemically in that way, in the historical context, and what identities have been privileged in creating a lot of these lines for comparison, and really moving towards community-based research, community-engaged research, where you're prioritizing the very distinct perspectives of a community and tailoring a needs assessment to those specific perspectives, and tailoring solutions to meet those unique needs. So it's like using community-based research to confront the larger systemic issues, and then thinking about how do we identify those, and then how do we use the research to correct those and do more informed organizing. So essentially, it's preventing extractive research by shifting the perspective into how are we looking at the system, the impact of the system, the historical context of privileging certain identities, and how do we move research in a way towards that direction.
I just wanted to add also the part that, looking to ensure that we're including identities into the research are ensuring that we're also, when we say community, that we're including our immigrant community. So in Forsyth County, there are 95 different languages spoken. And while that may be, how are we going to have 95 different languages, translated, interpreted for, they are a part of our community as well. And so how we do that when we look at opportunities to participate on surveys and things like that, I know that we have shifted quite a bit in over the last year because of the Weaver fire and what happened there. But even from that point to today, we are shifting towards having more things available in Spanish, and so that our Spanish speaking community can also be a part of research and all of that. But we can't forget about the other languages as well, because they are also a part of our community. So as we think about that, I think it's important to keep that in mind as well.
I will say another thing that we could do is having work like this actually community-led and community-driven, because we say that a whole lot, but a lot of these projects don't start in community. They start in an institution, and the institution has an idea, and then the institution, after they have everything formulated, then they come back to the community members and ask for their input. And I would really love for more people that have lived experiences like me to sit on panels like this and to be able to voice their concerns, or to be able to have constructive dialogue. But for a lot of this research to start in the community, because there is a community of people. You can go to east, west, north, south side, everywhere, and there is a community of people who have disparities that they're experiencing, and they have solutions around those, and they have discussions around those on front porches and in living rooms all day long. And they will never get to this room because they're not consulted before the research or before the stuff starts. And so before research has started, before any of this starts, I would really love for us to go back into the community, because I think that's where a lot of the harm is caused. We have an idea in our mind about what people are suffering from and what we can do to help them. And so we go from there, and then we consult community. So I think to lessen some of the harm, the potential harm, would be to consult community members first, and have this work actually community driven, and to hear more on public forums from people with actual lived experiences. I think that would lessen a lot of the potential harm.
I'd also like to add to that, just in thinking about like how do we carry that out. And one thing is slowing down and really understanding what does accessibility look like to bring community members into each stage of the research process, from design, from before design, like Marquita is saying, but into design and through reporting, and defining what that accessibility looks like. And the risk of not doing that is creating tools that you have no frame of reference of how people can even use them. So it's slowing down and understanding that community engagement work means that you're going to have to compromise institutional rigidity. And you're going to have to think through, like, how are we realistically making space for folks to give feedback at every stage, and not rushing the process, including them at the end, or including them in the limited ways that Marquita just outlined as well.
So I 100% agree with everything that was said. And I know it feels simple, listen to community, include these, allow community to inform the research and the work, compensate people appropriately for their expertise and their time. All of these things feel simple, but I just wanted to comment that, this hasn't always been the case in philanthropy. So while it sounds in a lot of, other places as well, institutions, other places. So I think it would do us a great harm if we don't, continue to assess our practices and what we're doing. And, if we end up going backwards, that would cause great harm. I feel like we've moved, forward in a lot of ways with the things that we're talking about and how we work and partner with community, and even at the trust, we've come a long way as well. So I think just continuing with the momentum and just doing a check-in with our organizations and with community to make sure that we're on the right path and that we're continuing to work together equitably to come up with the solutions to the issues in our community.
I also agree with everything everybody is saying. I think an additional potential harm and consideration that I think we're definitely still trying to figure out how to navigate, and we've definitely contributed to, is, so my husband is a small business owner. So I have some conversations with him about the living wage as he's trying to figure out, and they literally just started, so they're working their way up to things. But one thing I think is really important to remember is that our culture, at least the dominant culture, really, really is into numbers, and we're we must be data driven. As someone who does research with numbers, whenever you take something that is really messy and really complicated, like what someone's family needs or what someone needs as an individual, you are inherently taking something that's very, very complicated and you are smushing it and making it simple so that it can be a number. Numbers can be a really powerful tool. They're not the appropriate tool for all situations. We really like to jump to them when they're maybe not the best answer to the question. It's also just really, really important that we always keep in our heads everything that happened when we squished those numbers or when we flattened things to make it a number. Because something I hear when I'm talking to people is people with lived experience, people in the community will verbalize things and be like, this is what's happening. This is my experience. And then I hear people sometimes from institutional perspectives being like, well, the data doesn't support that. And you're like, well, there's just all these ways that, reality to data, there's just things you have to know. There's some salt, usually a lot of salt you need to bring along with your understanding of what the numbers mean. And I think that's something we're also working on as an organization is I'm a little terrified sometimes when I have conversations with people and I'm like, oh no, there's so much salt with this number. Please make sure that you understand all of the complexities around how we simplified things. So I think if we're talking about what are potential harms in this work, that is something that still weighs on me, is I want to make sure that however we communicate about a living wage, that we're never in a position where if somebody is talking to their employer and they're like, yeah, I just can't make it work to keep working here, that their employer is well, Forsyth Futures told me that you should be able to that's not what we're saying, but we just need to make sure that that's really, really clear.
Thank you. I think that's so important because I bet every single one of us in this room needs something a little bit different for our lives, right? As far as we're looking at the money, what is in our joy bucket? For some people, it might be going to the movies. For some people, it might be I got a new bottle of nail polish last night, which brought me a ton of joy because it's gold and shiny and it makes me happy, but it can be anything. It can be having just the time. We talk about time poverty, which we haven't even talked about here, but just the time to go to Reynolds Gardens, which is right next door, and walk in the woods for an hour and just enjoy nature. Those things are all really, really important. And I think we have to expand our definition of data. It is numbers and it's Marquita's lived experience. It's, whoever else's lived experience. I'm picking on you, Marquita, just because you're up here at this table. But, it's everybody's lived experience. And we have to realize that sometimes that feels really weird to start bringing in, especially when you're talking about qualitative data, really bringing that into the room and like, how do you mush that into like a report or a research paper that y'all are writing and, for one of your classes or whatever. It's really counterintuitive to how we've operated for forever. I was say for so long, but maybe forever, especially in white spaces and dominant spaces. And Kelly isn't here today, but I want to bring her words. I have a screenshot of a text she sent me saved on my phone. I have a folder called Read These on the Hard Days on my phone. And this is one of the things. And I think this is just so important when we're thinking about some of this, because it can seem like, how are we going to do this? Like, how are we going to bring and focus on start research in communities, not with institutions? And it feels weird. Like it does. But she says, we're not checking boxes and using buzzwords to sound good. I know it's different and uncomfortable at first, but the more we walk and work this out, the more everyone realizes how good it feels to simply do the right thing. It's so crazy how the right thing can feel so counterintuitive because we've been doing the wrong thing for so long. And I read that like once a week, once a day. To remind myself when sometimes I have that feeling like, this feels weird. Am I the only one? Does anybody else feel this like tension around this practice that we've always had? But I think it's really good to sit in those spaces and interrogate like, hey, yeah, this doesn't feel good to like only look at numbers. Like Forsyth Futures said, you should be able to live on this. So why can't you? When we know everybody in this room needs something a little bit different. And we should all have those things, right? Everybody in this room and everybody not in this room, especially the people not in this room, should have everything they need. So this is technically our last question, but I think we can just go wherever we want after this, y'all. If we have time, we don't have time. Adam's shaking his head. Just kidding. Real quick. When we talk about equity, we often, acknowledge the value of insights from those with lived experiences, like we've heard, or the way Crystal always puts it, which I love, which I have to write down, people closest to the place of urgency, which I think is a really good way to think about it, the people closest to the issues. Like we've talked about, involvement tends to be minimal and engagement is compartmentalized. It's not holistic. It's only for one piece of the process, like you were talking about. And a lot of times people are compensated through stipends or gift cards rather than real substantive employment, even though institutions that I work for or have worked for really do a lot with those reports that we'll bring up and say, hey, look at this report we did, and we'll try to get funding from funders for it. I work in funding. Again, I work for philanthropy. But that knowledge is coming off of the community, right? And so how do we shift towards really equitably engaging community and ensuring that the experts, because the experts are the people closest to the issues, right? It's not necessarily somebody with a PhD or somebody who does research for a living or as a funder or whatever. How do we shift towards really making sure those people are heard and employed in a way that provides opportunity and benefits afforded to others who maybe do work in a big institution that does research? Because what our currency is information, but where are we getting that information, right? And how do we compensate folks for that?
I think, like we've all said it here, like we talk about community-driven stuff, and instead of saying community-driven or community-led, we need to make it really community-driven and community-led. We need to get out in the communities and talk to people and see what issues they're suffering from and what solutions they have and start there. But when we're starting these projects and these initiatives, community members, people with lived experience, should be employed as the program managers, the project managers, instead of coming in and having them give input and giving them a little gift card or a little, giving them dinner and sending them on their way. Why are they not salaried employees of these initiatives? Because they are doing a lot of the work. Now we have community members who have lived experience and are offering input. They're also the certified community researchers who are going out gathering the research. They're helping to analyze the data, and then they're going home with a gift card when everybody else in the room is going home with a salary. I think that's absolutely asinine. And then we talk about how are we supposed to help these people get out of poverty? Well, if you give them a job and pay them for all of that work they just did for you, that is one way that they can move out of poverty. And so I think we have to stop going to community and taking just what we need and leaving them where they're at. And we need to start bringing them along with us. If we're coming to you and I'm asking you questions and you're lending information to a project that I have and I'm getting paid, I have to find some way to get you paid too. But I'm not just going to leave you in your community once I get your answers. I'm going to bring you to the office with me. because there's something like, if you were that valuable to a body of work that I have that is pushing this work, and we're going to use this data for what, 2, 3, 5, 10 years off of something you said, then you should be in this office, a part of this work, not just this project, but ongoing projects if you are that valuable of a person. And so we have to start paying people in community what their value is instead of undervaluing them, because we do that a lot when we go into community. We ask people stuff and then we undervalue and I think it's crazy. But I think that's where it starts, going in there and giving people in community these jobs because they are more than qualified just because they don't have a piece of paper behind their name. I so hate that. We put all these jobs up, and I think we talked about in our last meeting with Vivian, jobs that come up for project manager roles or program manager roles that you have to have a master's degree or a bachelor's degree. And like, I have the lived experience. I've worked the whole project out at home, and I'm just waiting for somebody to come and listen to me, and I will get passed over for that job because I haven't been to a college or whatever. But people forget that I started at a deficit, so I wasn't able to go to college, because we know that a lot of white families or more predominant families traditionally inherit wealth, and lower income families, Black, brown families, they inherit debt. So there's no way I would have that same piece of paper that you have, because we were never on a level playing field. And so that already discounts me. But if you stop discounting me and value me the same way you would value someone else with that piece of paper, I think that would go a long way.
Mm-hmm. I would say because we, ABC, and I myself also believe in this, because statistically we know that people of color don't have the degrees, and just thinking about how can we do that, and the way that ABC is doing that, we're actually hiring for someone, and degrees are not required for us, because we believe that the experience that someone brings is more important than a degree. And a lot of times you have way more experience and exposure than someone that does have that piece of paper. And as someone who personally also went through, I couldn't get multiple jobs because I didn't have that degree, although I was in school and doing all of that, as I was undocumented and unable to pay for school, or had to pay at 3 times the price for being undocumented. And so, just thinking about what are all of those limitations and barriers, and how can I, in the place that I am, remove those barriers. But also thinking, we talk about how there is, in the question, you mentioned about minimal involvement, but also we create things or tend to institutionally provide events that are during work hours. My family, we weren't able to go to things or even sometimes go and get resources because my parents were working until 6 p.m. Like, we would all pack and leave at 6 in the morning. I'd be getting dropped off somewhere at my friend's house so she could take me to school at 8. And I mean, it was like, so all of these things, and even as nonprofits work, all of their services are during work hours. No one is going to not go to work to get something to earn money, because now they're going to be in a worse off position. And so I think when we talk about also minimal engagement, we have to also think about what are the hours that we are inviting community members, or even providing the services that they need. And being flexible as well with what are the hours in which people are working. What are those hours look like? Can they go drop off their kids in the morning and come in later? So being a lot more flexible, not just with degrees and experience, but also flexibility in where to work from.
Crystal, before you come in, I just want to say one thing to something that you said, Vivian. We often say that people of color don't have degrees, but I'm sitting looking at 12, 13 people of colors, and I know for a fact the majority of us are either working on a degree or have some form of degree. So we have to stop perpetuating that myth in institutions and organizations that when you go into the community, people of color don't have degrees, because we have degrees. We might have worked a little longer to get them, or had to what have you, go to school at nights or whatever. We have the degrees. We're not looked at as people who have the degrees, so we don't get the job. or we have the degrees without the experience because we went to school all that time and we can't get the job. So we have to stop saying that, because people are repeating that and saying that, oh, people of color don't have the degrees, they don't have the qualification. We have the degrees and we have the qualification. You just have to get out and look for us. Sometimes we don't even know that you're hiring for a certain job because it's not widely known. So you just have to get out. I think more jobs need to be more accessible. Positions like this need to be more accessible. They need to be more known about in communities, because I think the people are out there with the qualifications, that with or without the qualifications, like with or without the degrees, we just don't go looking for them. We just don't make it known to them that we have a position that they may be able to fill. And I think that that's one of the problems. We need to advertise better in communities where we're doing work so people can apply for these positions. But we also have to stop perpetuating myths in our institutions and organizations, in our community, in our own families, that people are unqualified or don't have what is needed to take the position.
I agree 100% with Marquita and Vivian. I'll say that I 100% agree with hiring directly in the community, doing the groundwork and slowing down to identify those people directly from the community to bring into the work. I'll add that I'm a strategist and I'm a solution-oriented person. So I'll go further to say that, how are you encompassing advocacy and research in doing this work and identifying, okay, the bar is not only community engagement to carry out the need of the project, but the goal is to add a layer of like long-term advocacy where how are we using this as an opportunity to build leadership, to build, to share skill sets, and making it mandatory that to do community engagement, we have to be able to identify where the opportunities are beyond the specifics of this specific program and of this specific project, so that you're not only engaging folks and employing folks within the timeline of the project itself, but you're also making it mandatory that this has to be invested in long-term advocacy and long-term investment beyond the timeline of a specific project or a specific program, because folks need to survive beyond the parameters of a program.
So let's thank the panel. We now do the data walk, but I will remind everybody that it's a QR code here. You want to get access to the poster. Also, we have the space for 4 o'clock, so you can still spend some time if you want to help. Thank you all so much for coming. And oh yeah, there's presents as well, and cookies. And other things. So those need to get eaten. Thank you again for coming. And as I mentioned, this is the first
also sort of like around like sort of like the ways and also